Bismillahirrahmanirrahim. Today we will talk about esophogectomy operation. What are the indications of esophogectomy? It includes high-grade dysplasia, cancer esophagus, mega esophagus complicating achalasia, and esophageal perforation. What are the types of esophogectomy in cancer esophagus? It includes Ivor-Lewis esophogectomy and McEwen esophogectomy. Regarding Ivor-Lewis, it is concerned with tumors of the lower third of the esophagus. A left thoraco-abdominal incision can be used, and after excision of the esophagus and the upper portion of the stomach, an esophagogastric anastomosis is performed. While for tumors of the middle third, the stomach is mobilized through a midline incision, and then the thorax is opened through the right fifth intercostal space, and the esophagus is excised down to the cardia. Then an esophagogastric anastomosis is performed. McEwen, which is a three-staged operation. Esophogectomy for patients with a proximal thoracic tumor located near the airways or with extensive Barrett esophagus, or if there is a concern of obtaining a proximal margin free of tumor. A modified McEwen esophogectomy or three-staged esophogectomy with a cervical anastomosis may represent a better option. A leak in the cervical space is generally also easier to manage compared with a thoracic leak and requires opening and packing of the neck wound. The steps of the operation are the same as for Ivor-Lewis esophogectomy. The thoracic inlet is then dissected and the specimen is extracted from an oblique incision anterior to the sternocleidomastoid muscle. A single layer anastomosis is constructed using a running 40 PDS suture. Now we will talk about esophageal replacement surgery. In such we mean in order to replace a part or the whole of the esophagus. First, we have gastric pull-up procedure. The idea is to mobilize the stomach completely with the preservation of the right gastric and right gastroepiploic vessels. The stomach can be brought up to the neck. Then we have colon replacement, in which a segment of the right or left colon is mobilized with preservation of the feeding artery and vein and the marginal artery near the wall of the colon. The colon is anastomosed below to the stomach and above to the cervical esophagus. Pectoralis major myocutaneous flap. This can be used to replace a localized segment of the cervical esophagus. The skin segment is rolled upon itself to form a tube with the epidermal surface facing inwards so that it lines the lumen. Lastly, we have free anastomosis. A segment of the jejunum is separated with preservation of the feeding artery and the draining vein. The feeding artery is anastomosed to an artery in the neck, usually the inferior thyroid artery, and the feeding vein is anastomosed to one of the veins of the neck. Thank you for watching.